and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
And I'm Brad Heineck, physical
Together we are the
therapist.
most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, we're going to kind of be pro-physical therapy advocates today.
For a good reason.
Yes.
If you're going to have a hip or knee replacement, there are people that wonder, do I really need to go to therapy after this? As a matter of fact, they might have talked to their friend down the road and he said, I didn't have any therapy.
And I did fine.
And I did just fine. And you're going to find people like that, and then you're going to find people on the other extreme where they had to have therapy for 6 months to get better. So,
Yeah, I've had people that didn't have therapy, and then we ended up having to see them, like you said, 6 months later, and then it was a struggle, and then we didn't get the results that we wanted to get.
Right.
So,
yep. I'd say with a knee, typically after a surgery, it's anywhere from 8 to 12 visits, and they're really doing well. One big thing that really makes people enjoy therapy is they're so relaxed.
Right.
They come in, their knees swelling up, it's sore, it's like, I couldn't sleep last night, it's sore, can you look at it? It's a little red there, and they're all nervous that
they're
going to
not as anxious because,
Right.
they're getting guidance
Exactly.
as they move along here. Because there's a lot of things that crop up, and you're wondering, is that right? Is that wrong? You know, I'm hearing this clicking. Am I supposed to hear clicking?
Yep.
Am I?
I hear that one a lot.
So, you know, we're here to make sure that, alleviate your fears.
Yep, typically I'll look at it and say, I've seen hundreds of knees, this looks just normal, there's
Right.
no problems. Right there, the person relaxes.
And then there's those small cases where, small instances or less frequent instances in which someone does have a little bit of an infection.
Right.
I've had 5-6 cases of that,
Yep.
and we stopped it from getting worse.
Right, you could have
So-
a blood clot in your leg.
We've had a few of those.
Right, it's rare, but we catch those things.
Right.
Okay.
And
then,
did you say the better success rate?
yeah, we said that.
Oh, you did.
But
Okay.
the reason the better success rate is because, one of the reasons is because the home exercise program they give you from the hospital is good for about 1 to 2 weeks. After that, you need to advance it. You need to go to things that are going to help you get out of a chair easier, how to get up and down steps easier, how to get the range of motion from 90 degrees to that 110 degrees. Then if the big question is, can I go on my knees when I get done with surgery?
Right.
That's another thing we can help you through.
Yeah, I think that you're going to find out, and I think that's pushing to the last reason that you're going to mention here, is that a lot of people just don't stay on task.
Right.
I mean,
Yep.
it's very rare that I find someone that can push themselves and on a regular basis and keep with the program.
Yep, you need that coach.
Yep.
Yep.
And unfortunately, a lot of times people will not push themselves into pain at all. either.
Right.
And after knee surgery, quite often there is pain involved.
Right. Hips
So,
go a lot easier.
hips go a lot easier.
You will not need as much therapy typically after a hip surgery
Right.
as a knee.
A little less guidance usually.
Yep. So if you're going to have that surgery done, just plan on therapy. Make sure it's a successful overall replacement, and you'll be out dancing, doing the jitterbug. Who knows what you could be doing?
People don't even know what the jitterbug is, Brad.
They do too.
You
These
old person
people,
here?
yeah, they're older. People are getting their replacements done when they're in their 50s to
Oh, yeah,
60s.
I suppose.
They know that jitterbug.
All right, they probably think it's that phone.
Maybe
it's called
not
a
in
jitterbug.
India, though. And,
Yeah.
And over in Germany, they're doing the polka.
There you go. And I'm German, so I know that. Thanks for watching.